You're watching Living Smart in the Lowcountry at St. Joseph's Candler, really learning a lot about cancer care. Right now, we're going to switch gears a little bit to talking about prostate cancer. This is one that I know a lot of our viewers want to know about. Dr. Chahin is here to tell us a little bit about it. Thanks for joining us.
You're welcome. Thank you for having me.
Let's kick it off today, Doctor, with a question about PSA level. This is something that can get our discussion going. I really would like to know basically what it is and what it means.
PSA is short for prostate-specific antigen. It's actually a protein produced by the prostate tissue. And the higher the volume of that tissue, the higher the level of PSA. It is produced by cancer cells as well of prostate origin. And because of that, the rise as well makes you suspect there's a presence of cancer. So typically, an enlarged prostate that's benign can have an enlarged PSA up to a level. Beyond that, you start suspecting that maybe there's cancerous tissue that's either in that location or elsewhere in the body. And that's why it's used as a specific marker or a screen for prostate cancer. Bear in mind, it could be increased sometimes in inflammation. So when it is tested as a screening tool, the person hopefully would be without any serious problems or symptoms at that time.
Okay, interesting to know that. Let's talk a little bit about strategies when we're talking about prostate cancer to really help with detection. Let's start there.
Well, there's really the most important tool at this point, which is evolving really, is to understand which person is at higher risk. So there is risk stratification for individual without any problems or symptoms that are getting screened. For example, ethnicity. African Americans have a higher risk of prostate cancer, especially for us in the Lowcountry, and it is typically more aggressive. So you want to start your screening earlier if you're African American at age 40. You need to check as well the family history, which is very important, and other factors including smoking, weight, exercise. So typically you can start screening for higher risk at age 40 and at 45 for average risk. That's the initial assessment. Once you suspect that there's potential cancer and you establish the first biopsy, then there is risk assessment as well for that individual with the diagnosis to realize if this is a aggressive or non-aggressive disease. So quite a few strategies are involved with that, from mapping the prostate with a MRI, assessing systemic evidence of disease, the level of rise of PSA. So quite a few things that the physician will implement to actually follow that individual and move them in the direction of speedy management or a short wait and see pattern, just basically to make sure that we're not intervening in things that doesn't require intervention. For an elderly person, for example, of this diagnosis who has a low-risk disease may live their lifespan and not have to deal with it.
Yeah, and that would be obviously ideal. We've only got a minute left, but I want to make sure we talk about various treatments, of course, and what somebody might go through for an aggressive or non-aggressive tumor.
Well, I touched quickly upon the fact that you may want to monitor certain people with low-risk disease, multiple other risk factors in their life. They may not really need to intervene with this cancer. Now, the more aggressive disease, there's clearly early stage and advanced stage, and that's where the screening comes along. The earlier the stage is, the more likely the curative intent, and the more advanced stages require us to be a little bit more of control the disease and prevent it from causing any problem. And one of the newest tools that we have is the molecular markers in those cancers. We look into the genetics, and the genetics can tell us sometimes how aggressive the cancer is, but not just that, it can point us towards specific treatment for that individual that may not be what we treat generally everyone else. So it is an important part of assessment initially for that therapy. Now, of course, now we are doing a more aggressive, specific, localized treatment in radiation like CyberKnife And we are doing a lot more targeted therapies for the advanced disease.
Okay, all great information. Dr. Chahin, thanks so much.
You are welcome. Thank you for having me.